Good morning.
Good morning, Alicia. How are you today?
I'm very good. How are you?
Very good, thank you.
Okay, so please feel free to introduce yourself, your job title, and what it is that you do.
Wonderful, thank you. So good morning. I am my name is MAJ Grove. I am a doctorate of nursing practice. My specialty area is psychiatry. My title is psychiatric nurse practitioner. Psychiatric mental health nurse specialist is another name for it.
Wow.
What I do is I provide behavioral health services. My priority assignment is to diagnose, assess, and treat mental health conditions. I am a medication prescriber, so part of that lane is to provide medications to my patient population if it's appropriate.
Okay, thank you. So what age range would you say you work with the most?
So primarily I am licensed to cover across the lifespan. However, this is a population that's particularly ages between 18 and up to 50-ish. The bulk of the population is in the curve area of around 20 to 30.
Okay. Among people that you meet with in this range, would you say there's a stigma around mental health?
That's a really good question. I'm glad you asked that, because one of the problems with behavioral health is that there has been traditionally a stigma surrounding care in that area. But I always like to say that you can't separate this from this. So if this isn't working, this isn't working. And in fact, if you have issues with your stomach, there's often times when your stomach can actually, the problem is not your stomach itself, it could be anxiety or it could be stress. So this is a functional unit. The Army over the last couple of years has really been making strides to reduce stigma and to encourage soldiers to come and be seen when they have problems. In fact, it used to be years ago, if you were, and there are still many of us in this generation of my age that would never have gone to behavioral health because there was such stigma that if you were seen, the idea was if you were seen by behavioral health, then you may be separated from the Army. So in the last 20 years, we've had a lot of combat, and we've seen a lot of mental health problems as a result of chronic deployments and redeployment cycling, not just on the soldiers but on their family as well. So the Army has really made strides to push behavioral health as a positive thing, although I would say that there are areas within the military where people are very uncomfortable to go. There are certain jobs that have issues with going to behavioral health because they will be seen as weak, or maybe they will be concerned that their career might be at risk. So for instance, some of the populations might include infantry soldiers. They feel like if I go get seen, then I won't be able to, or pilots, I will be grounded if I have behavioral health issues.
Wow, okay. So you said the Army's been making strides to get rid of the stigma. Can you give an example of some of the things that you're doing?
There's been some campaigns that the Army has put out, and in fact there's a number of Army bases, maybe you've experienced this, where seeking help is a sign of strength. At Fort Bliss, where I came from before I was here, Fort Bliss is a large base, and they had a lot of suicides. They had a lot of issues with depression and anxiety, and so the base commander put out an emphasis on behavioral health improvement. So they would come into the gate and they would see a sign that says, seeking help is a sign of strength, and there would be numbers, call the chaplain, call behavioral health, this sort of thing. I think trainings, starting in basic training in AIT, they learn suicide awareness. I don't know that it's necessarily being taught at that level, but I think that in permanent party, in cadres around bases in the United States, that there is some positive light on being seen by behavioral health.
Wow, okay. That's awesome. So they saw an improvement because of this campaign on their base?
I think because the Surgeon General put out a couple years back, there was a high number of soldiers that were committing suicide, and the veteran population alike. And so I think the Army began to understand that we need to start healing our soldiers.
Right.
So there is a definite drive and improvement for the Army's soldiers to be seen by behavioral health if they need to.
So for the people that you see in this age range, what has the pandemic made their life into like? What does it look like for them?
The pandemic has caused a lot of problems, and because we are a social organization. The problem is that when you have isolated people, they can't work in groups that they normally do.
Right.
So for instance, it's been affected at the training level. Your father's command sergeant major here in this organization, and he can testify that the training aspects have definitely impacted, the COVID has definitely impacted training. We've had groups of soldiers that have come in larger numbers, I think, because of social isolation, and a sense of mental health has become problematic because of that social isolation. You know, human beings are social creatures by nature. Even the most unsocial of us, that when people would say, I'm not really a people person, but we need one another. And so that isolation has been problematic. We've seen more suicidal ideations, we've seen a lot more depression, we've seen a lot of anxiety, hopelessness and helplessness, which are all part of depression as a result of COVID and isolation.
Wow.
Not to mention, I think that COVID has affected people at a lot of levels socioeconomically. I mean, families have been affected, and within the military population, spouses who normally worked, for instance, that now were having issues, and so finances have suffered, I think, in a lot of families because of it as well.
Wow. So before the pandemic, how many patients would you say you've seen on a daily basis?
For the most part, behavioral health has been a steady business anyway. Can I say that I've actually seen a lot more patients because of it? My environment changes. So for the most part, before the pandemic, I was in the clinic up at Kenner. So here at Fort Lee, we have a fairly small operation, and most of our assets are up at Kenner Health Clinic. In late last year, in August of last year, there was a suicide on the ordnance side of where we're sitting today. As a result, the general requested behavioral health services in the ordnance side of post. So this actually opened up access to care for soldiers that may have not come in the past, but we have seen high volumes of soldiers here. My average patient load over in the TMC, where I provide walk-in care to these soldiers, is anywhere between 7 to 13 patients in a morning, which is a lot of soldiers.
Okay. So what issue did you see most when working with these soldiers?
So there's a lot of changes that happen within this part of the training to soldiers. A lot of them come from high school. They're 18 years of age, they graduate. Many of them have no prior understanding of what the Army looks like. So this, we could say that anytime you have an adjustment to a new lifestyle, you're going to have issues, right? So whether you end up going to college or whether you join the Army after high school, you have to learn to adjust to your new operating environment, away from your parents, away from what you were comfortable with. I would say that that's part of the issues with joining the Army as a whole, is that adapting to change. So we have a spectrum of patients that we care for. The training organization here, where the AIT soldiers are anywhere between 18, where I said just coming out of high school. They may have come into the Army for economic reasons, and they may be older, 25, even up to 30 years of age. So they have reasons that they've joined the Army. Maybe it was, like I said, economic reasons. I've actually seen a number of soldiers come in just because COVID blocked opportunities that they would not have been able to otherwise have had COVID not been in existence. So we have had a number of soldiers saying that they came in and joined the Army because of COVID. Then we also take care of a permanent party. These are soldiers who have been in the Army for a period of time. Some of the issues that we might see with them is PTSD from combat trauma, changes related to marriage issues, children issues. They could have problems with stress and reactions to a new duty station. You understand, moving from base to base has its own stressors on a family. So those are some of the things that we'll see. There's often times when I'll see a new soldier that has a new diagnosis of a behavioral health condition, such as bipolar disorder or schizophrenia, and they are a different sort of a category because that's not the bulk of the normal population we see in a healthy. So understand that for the most part, the soldiers that we see in this age range are in a healthy population.
Okay.
So physically, emotionally, for the most part, they have issues. The primary issues are depression, anxiety, poor sleep. These are some of the most common things that we treat. Our services at Behavioral Health also will include substance abuse issues, alcohol, drugs. Family advocacy is another aspect of it where we're having issues in our family home, parenting issues, or maybe domestic issues. So those are assets that they'll be seen for. Sometimes you have children that are struggling, so we also have child adolescent services. But my population is the 18 to 50-something-year-olds. So if I have a patient that's diagnosed with bipolar disorder or schizophrenia, those are kind of outliers on the
Right.
scale. Yeah.
Okay, so after the pandemic got into motion, would you say that you saw more soldiers?
Yes, I definitely, especially since I'm over here, as I mentioned, part of my role is to provide services over to the AIT soldiers in the ordnance side of post. And so for your audience that doesn't know, this is a training where Army soldiers come after basic training to do their AIT. AIT is where they learn a job skill. So on this side of Fort Lee, we have a number of jobs that are trained here at Fort Lee. On this side of the post, this is what we call the ordnance side. These are things that have to do with combat MOSs, like they could be mechanics, they could be small arms repair, they could be, there's a whole sort of them, but they all have to do with combat arms stuff, support of combat arms.
Okay, so has the pandemic affected the types of issues that soldiers come to you with, or would you say it's more the same in your patients?
So I think stressors always exist. I do think the pandemic increased stressors on people. As I mentioned in the beginning of the interview, the soldiers, when they first got here, had a lot of restriction of movement. So they were isolated as a result of that. They were not allowed to be in groups larger than 10 in some cases. So the Army is a very social organization. And so being close to soldiers is, just the normal thing in the training environment. They eat together, they breathe together,
Right.
they study together.
Like a family.
And so during the pandemic, when they left basic training, they had to quarantine. When they got here, they had to quarantine, and at that time that was 14 days each. So they really quarantined for almost a month. And then if somebody got exposed, their roommate had to be quarantined. And so this affected training schedules because if they missed a certain amount of time, they had to be recycled. So this increased a lot of stressors on this population because of their restriction of movement and the quarantine that occurred.
Okay, so when your patients come to you, what process can they expect to undergo to solve the issues or problems that they're having?
That's a good question too. So our goal is to tailor treatment to the soldier's needs. And what we normally like to have them do is come in for an initial intake. It's like a scheduled intake where they're kind of interviewed by a technician or a social worker to identify some of the concerns that they have and then to appropriately tailor treatment. We like to have soldiers start with therapy. And in therapy, they can identify their issues and they can have a therapist give them some structured goals and some homework and some challenges that they can work through to identify, to resolve the issues they've identified. For me, because I'm a medication provider, that's one of my major roles that I'm performing in this environment. Once they've been identified with certain stressors or conditions, then that intake person makes a decision of whether they need or would benefit from a medication appointment. The soldiers, everybody in behavioral health this is the patient's right? The patient's rights and responsibilities. are huge with us. We, as I said, we tailor the treatment to the soldier, or in the civilian community, it's tailored to the individual who comes in seeking treatment. So they don't have to be on medications, they don't have to have therapy. They have whatever is going to be appropriate for them, but this is why they come to see us, so we can give them the tools and we can give them the options. Education is huge with patients that come to see us for behavioral health, because we want them to get better. We want them to be healthy and happy and the best them that they can be. So if it's medication plus therapy, or if it's medication alone, or it's therapy alone.
Wow, okay. So are there any general resources that you give to your patient population, like no matter the problem?
Yeah, that's a really good question too. We do like to give a lot of educational pamphlets. So let's say a patient comes in and they have anxiety. I have a huge stack of resources on the table, and it's a pamphlet that has deep breathing techniques, it has thought content, how you can challenge thought, how you can, nutritional, sleep recommendations. But let's say the patient comes, or the individual comes in and they have depression. Well, I want to educate them on depression, so I'll give them a booklet on depression. I'll give them a handout so that they understand how their symptoms affect them and how they can manage them and how they can talk to their family and their friends about the depression. So patient education materials are important, and we do provide those.
That's awesome. So what are some warning signs of onset mental health issues that others and I can work to recognize in people close to us?
That's an excellent question. If they're people that you know, it makes it a little easier, right?
Mm-hmm.
Because you know what their moods. If you've been around somebody for a while, you can tell if they're doing well. How often have we seen somebody that looks down, they look sad, and you say to them, "Hey, how's it going?" And they say, "Okay." Well, that's kind of a sign that maybe they're not okay. Maybe they're just having a bad day, right? It doesn't necessarily mean they're having a behavioral health issue. But I think that when we are observant of other people around us, and we take the time to care about each other, right? And this is what it all boils down to, is do we care for one another? I think that's an important message right there, is that we care for one another. And especially in this pandemic, that's so important to know that we are looking after each other, right? The pandemic has caused a lot of problems, and there's a lot of people that are suffering because of it. In fact, suicides are on the rise right now. Because of that, some of the warning signs is that somebody is saying things that make you wonder, are you safe? They might be saying things like, "Oh, I just wish I didn't have to wake up. If I didn't have to wake up and I just died, it'd be okay." Or maybe they're isolating, maybe when they were normally very social. Or maybe they're giving things away. Or maybe you've seen a change in their appetite or their sleep patterns, and they're just not themselves. One of the important things that we learn to ask one another is, are you safe? Have you ever thought about taking your own life? A lot of people are uncomfortable with that, but there's a training that the Army provides us called assist training. And in that training, we are taught to specifically ask, are you thinking about killing yourself? Straight up, right up like that. Now, do I mean that you should go around asking anybody that looks down, like, should they kill themselves? No. But you said warning signs. I think there's some pretty clear warning signs of somebody who's thinking about self-harm. And so things like I said, they're thinking about giving stuff away, they're isolating when they're normally social, they're not their usual self, maybe you're seeing signs that they're doing something like cutting. So I would say watch your friends, watch somebody that you work with to see if there's been a change in their behavior and any of those warning signs that I talked about.
So, what are some general steps that people can take to improve the condition of their mental health, no matter the problem?
Excellent idea. I think self-awareness is huge, right? And so a lot of times we are so busy taking care of all of our obligations that we have to do, trying to finish your homework, trying to get your test done, being on time for practice. But I think self-awareness is huge. I think the goal is that we find joy and meaning in life, right? So when we're thinking about what are some techniques and tips that we can use to self-improve, Number one, nutrition is huge. If you don't fuel yourself well, your brain and your body cannot work well. So I would highly recommend nutrient-dense foods, things that have healthy proteins, vegetables, fruits, balance of all these things, avoiding a lot of refined sugars, a lot of caffeine. This is a generation that does a lot of caffeine, a lot of energy drinks and cafe mocha lattes and this sort of thing from Starbucks, you know. We like our caffeine, but caffeine can have issues with, it can dehydrate you for one thing, and it can also cause impairment in sleep. I also think that we need to drink a lot of water. I think we need to exercise. The American College of Sports Medicine says that we should they recommend rather 30 minutes a day, 5 days a week, 3 days of strength training and 3 days of cardio and 2 days of strength training. So exercise, taking a walk when you're stressed, getting some, doing some deep breathing. I teach something called deep breathing, which is very good to reduce stress. And basically what you do is, I call it the box breathing, and where you're exhaling for 4 seconds, you're inhaling for 4 seconds, you hold it for 4 seconds, and you exhale. And if we do this 6 times, it decreases a lot of that adrenaline flooding that causes us to go into anxiety mode. It should be practiced on a regular basis. Talking to friends, finding somebody. Not everybody is social, so if you're not a social person and you don't make friends easily, you don't know how to talk to people, some of the things that you can do is journal. Journaling is very effective in helping us to take good care of it. It causes self-awareness. So I would say definitely, and then faith. I'm a person of faith, so I believe that faith is important.
Okay, that was really good. Okay, so what coping mechanisms do you recommend your patients use to deal with negative emotional effects of the pandemic?
Oh, that one's a good one. Well, first of all, everybody's situation is different. And so if you are in a home where your parents have lost their job, or their finances have changed because of that, that's not stuff we can control, right? So basically the idea is that we can only control what we can control. We can only control this person, right? We can't control whether a pandemic is affecting our day-to-day life. We can't control whether our parents or we lose our jobs. But we can figure out ways to remain healthy in the midst of it. And that's going to be pretty overwhelming because not all of us have tools. So one of the things that I always say is that this too shall pass. I know it sounds like a blanket, or it sounds like a Band-Aid, but this too shall pass. And to find ways that bring you joy. I mentioned some coping things, I mentioned some health techniques.
Right.
Exercise is huge. Even if you can't get out of your house, if you're in quarantine, you can do sit-ups or push-ups, or you can do the deep breathing, do some meditation, reading. I think everybody is over this. Appreciate you letting me have my mask off for this interview. I think, the mask itself has been very restrictive, and a lot of us are like so over it, we can't wait to get out. But then at the same time, we have fear that we might become exposed to this disease that we know has taken people's lives. But I think that fear is a source of a lot of the problem here. And because we're fearful, we may go into the avoidance. We may not talk to people that we normally would. But I think that fear itself is a problem, and I think that we can overcome that by rest assuring that there are people who are helping us to get over this. It is one of those things in the world that we have no control over. And so we can only control this. Again, it all goes back to what is my scope of control?
Wow. So, can you explain a little bit more about the scope of control? I like how that sounds.
So scope of control means that I can't control what you do.
Right.
I can't control what they do. I can't control what President Biden does. I can't control what the Army decides that I'm going to do. I'm going to be where I'm supposed to be and do what I'm supposed to do. So knowing what was within the limits of my ability, right? What kind of things can we do to control this? So again, it all goes back to perspective, I think. When we have feeling like we've lost hope, that's time to seek help, right? So you want to find somebody that you can talk to. You want to find what your behavioral health resources are. I would say also that in general that we have that perspective that the pandemic is going to change over time, and we've already gone through a year of this, so we're not at the beginning of it, we're hopefully at the end of it, right?
Hopefully.
Right.
Hopefully, yeah.
I think this is something we learn in life, is that we only can control this person.
Right.
We can't control what our parents do, we can't control what our friends do, we can't control what the Army does and any of this. So what we have to do is manage self, right? One of the things that I would say is that is actually an easy button when you realize you can't control that. So why am I trying to control that, right? All I can control is how I respond to situations. I can control whether I do well. I can control whether I am able to study and pass my test. I can control whether I am kind to one another, to another person. I can control the words that come out of my mouth. I can control whether I am going to embrace the hardships in life or whether I'm going to accept the challenges of them. So basically it's understanding that you can only manage this person right here. And how we respond to it is huge, right? So we can say, I'm going to embrace this challenge and I'm going to do well in the midst of it.
Mm-hmm.
That's the best alternative, because the other alternative is quitting, right?
Right.
And we have a generation that allows us to give up really easily. It doesn't meet my needs. I don't like that. I'm not comfortable. I'm not happy. Well, we choose whether we're happy or not. Happiness is an emotional state. It's not, it changes. We can be happy one day and not happy the other, but it's a steady state of joy that we try to attain. A sense of stability within ourselves that I am able to do all things. I can conquer this. And when we don't have those skills, that's when you go and you seek help. That's when you find somebody who can help you figure that out. Because, like I said, we can only manage this person here. And I think that makes life easier when you realize I can't control that, so let me just figure out what I can do that's in my lane, so to speak.
Right. All right. Wow. Okay, last question. What self-care practices can students who are planning to go into the military implement now that will prepare them for life in the armed forces?
Wow. Okay. So having been an enlisted soldier myself, I also went to basic training. And I was 22 years old. I was at the end of my junior year at Michigan State.
Mm.
Well, I was struggling with depression when I was in school. Michigan State's a big university. My father was a physician. He was paying my way through school, and he had a standard. And I don't think that he understood, and I don't think that I understood that I had some of those warning signs you were talking about of depression. And so my grades were failing, and basically he said to me, well, you know, you're on your own. And so I had to figure out how I was going to move forward, because I'd been a college student. I didn't have any skills other than working fast food, right? So I went to see a recruiter, and for those of you who are thinking about joining the Army can provide some amazing opportunities in life. Everybody isn't cut out for this. This is one option, but I think that I had hindsight on how to cope through the adjustments of being in the Army. Things would have been different. So when I left college and I joined the Army, suddenly I found myself in that situation I was talking about, where I'm told where to go and what to do and how to be and what I can say and what I can't say, and this was huge change for me, and I didn't do that very well because I was a free child and I did my own thing. But this was good for me because it gave me boundaries, and it gave me some sense of security that as long as I did what I was supposed to do, show up and be where I needed to be, that I was going to be okay. But adapting to that is big. And so I would say do your research, know yourself, know what questions to ask, know what job to pick that fits you. Never just jump in the Army because it's there and it's available. You need to know what skills suit you. So if you wanted to join the Army and you were kind of in a situation where you felt desperate, and the recruiter says, well, all I've got for you is to be a tanker or to be a mechanic, and that's not your personality, then you want to wait and you want to get the job that suits you. So once you have a job that's a good fit for you, that's helpful. The Army is now doing some things to help prepare soldiers to come into the Army. And one of them is that they have some courses that they can take online, so they know what basic training looks like. They know what the new PT test standards are. They know what Army day-to-day life looks like. So I think that anyone who wanted to think about joining the Army would want to look at those pieces of it before they just joined. Because you're signing a contract, and this is
Right.
the big piece of takeaway that I like to remind our soldiers is that when you join the Army, you signed a contract. That's a commitment. You stand in front of a flag and you take an oath to serve and defend your country. And that isn't something you should take lightly. So a lot of times, again, the society makes it easy for us to quit, easy for us to leave, you know, because we're not comfortable, we're happy. We live a very comfortable life, first world America, right?
Mhm.
But to join the Army means you give up some of that to serve. And so I would say that if you're going to serve your country, you want to think about what you're committing to before you do it. Because it's like a marriage. You're contracted to serve your country for a period of time, and once you sign that contract, to me it's an integrity thing, and you're committing to supporting and defending your country in exchange for skill sets and education.
Wow. So I know you speak from the Army because that's your experience, but what you just said, that can apply to all
Absolutely.
the branches? Yeah.
Not only all the branches, but it can also support in life, right? When we commit to a job, sometimes it's not the best place for us, but if we learn to stand when things are difficult, complete things, there's accomplishment in that, and I think it's powerful. I think we need to learn to finish and stick to things and commit to them. So if you play sports,
Yeah.
you know, right? You show up for practice and you're supporting the team.
Yeah.
So it isn't just about you, right? And I think that's the big thing is that, you know, we live in a me society. And sometimes me gets overwhelming and me needs some support. And that's why I recommend behavioral health. But also I think too that because we're so independent that we forget how important other people in our life can be to support us.
Right. That's all the questions I have. Thank you so much
You're very
for
welcome.
meeting with me today. It was so nice hearing what you had to say.
Well, thank you, and I appreciate what you're doing too to bring awareness to our young people and to the community about mental health, because it's something that we have had stigma with in the past, and don't ever be afraid to ask for help. Asking for help is a good place to start. Just being brave enough to say, "Hi, I need some help."
Right.
Thank you.
Thank you.
And good
I
luck
really
on this
appreciate
project.
it. Thank you. Can I shake your hand?
Yes, you can.
Thank you so much for being
You're very
a major
welcome,
girl.
and good luck to you.
Thank you. And that's it. You can press this.